Hey guys, this is Vicki. Let's take a little bit of time here and we'll look at parts of the RN role. The first major area that I would like to discuss is the NCLEX. I'm assuming that you're all aware that you have to take the NCLEX, and in order to become an official registered nurse, you do need to pass that baby. I know that the NCLEX brings a lot of apprehension, it brings a lot of worries. But there are a lot of people who pass their NCLEX each and every year, and as long as you're well prepared and have studied, I believe that you'll do just fine. So first off, what is the NCLEX? Well, it actually stands for the National Council Licensure Examination. So it's obviously a national exam, and it does regulate the entry into nursing. And by doing that, it safeguards the public in that everybody who has passed or taken the NCLEX exam and has passed is to be at a certain standard in order to provide safe care. It also assists the State Board of Nursing with knowing that you are competent and at the basic level, entry level, to become a registered nurse. So the NCLEX really is evidence of competency in providing safe and effective nursing care. So that's in the end why you all have to take the NCLEX and pass it. Now when we look at the NCLEX examination, we know that it is broken down into a specific test plan. And you can take a look. If you have the PowerPoint up on full view like I have it, you will be able to click on both of these links. This orange link will take you to the RN test plan, and then this will also take you to the RN test plan PDF. So you can take a look at this information. But the content of the NCLEX-RN test plan really is organized into 4 major client needs categories. Two of the 4 categories are divided also then into subcategories. But one of the major ones is safe and effective care, and within that is the management of care and also safety and infection control. The second main category that you'll be tested on is health promotion and maintenance. The third major category that you'll be tested on is the psychosocial integrity. And then the last one will be physiological integrity. So within that category, there will be basic care and comfort, pharmacological and parental therapies, a reduction of risk potential, and adaptation. Now you can also see the percentages of how the test is broken out by that pie graph that's in front of you, but you'll see that approximately 20% of the exam is going to be on management of care, and the next largest area will be on pharm at 15%. So this is kind of how the test is broken down into how it's testing you and on what it's testing you about. Now, does that help you? You know, I'm not 100% sure if knowing this information does help you, but you can take a look at the test plan by clicking on the links like I described earlier to at least drive how you may potentially want to study for sitting for your NCLEX examination. We do know that the NCLEX is an integrated process, and that processes are fundamental to nursing, and they're integrated into the questions. So when we look at the 4 major categories, we know that the nursing process obviously is that scientific problem-solving approach to client care. And when we look at the assessment, at least in terms of NCLEX, it is gathering the information and data about your client. So looking at the subjectives, the client's perceptions and understanding, the objective data, observed and measurable, what's their historical data or their past medical history, and what's currently going on. It will also analyze, group data so that you're able to group data and identify problems. So within that, it'll be nursing diagnoses and clinical judgment about the problem that the situation presents. It also assesses you on planning, so setting realistic and measurable goals and developing pertinent nursing interventions to help the patient presented in the problem meet different interventions to help them to a safer environment or rid them of the disease process that they currently have. implementation, so implementing those interventions and nursing actions, and then evaluating or documenting the process is what's really looked at for the nursing process. It also takes a look at caring, communication, documenting, and also teaching and learning are definitely integrated within the NCLEX examination. Now, the actual NCLEX examination is considered computer adaptive testing. And what that means is that it's an interactive process as you go, and that it selects questions based on your previous responses. So it kind of gauges each question, and it builds on the answers from previous questions. The exam doesn't end until it is assured that with 95% stability of the pass or fail result is certain, or your time runs out. I think that this video that I put, you can click on this video here. It does show a really good example of how the test plan works. It is also posted in Blackboard. So take a look at how computer adaptive testing is used within NCLEX and how it gauges whether you're above the standard and you can end the test or you need to continue on. So let's just say you're taking the test and it shuts off at 75. You've either done very well and you are above the standard, or you've just done that poorly and you're not going to be able to rise above the standard that was set. But know that the questions, it's not uncommon for them to become more and more difficult until you can't answer the questions. And that is a normal part of the computer adaptive testing. So please take the time. It's a very short 6-minute video on computer adaptive testing. Please make sure that you watch that. Now when we talk about application for the exam, now I know that this is a summer course, so you won't be getting this information until fall. And if you're viewing this and it's not summer, then you will be getting the information closer to when you graduate. But prior to graduation, an email will be sent to you. Typically, for North Central Technical College, that email will come with Wendy Ludwig. So she typically sends emails mid-March for May graduates and mid-October for fall graduates. And within this letter, it's very detailed and it explains all of the steps that the new graduate nurse will have to take. One of them, though, is for the online licensure application system. You'll often hear it referred to OLAS. But within there, you'll create an account and enter your information. At some point, so the OLAS was actually, just let me give you a little bit of background information on it. So it was created by the Department of Safety and Professional Services, and that's where our nursing license comes out of, to allow applicants to apply online for licensures. So applicants can apply and pay fees online, which really does eliminate the need for any paper application, which has been a great step. Schools do submit, so NTC will submit this statements of graduation information online as well, but that will come after the grading day. So if you graduate in fall, it'll happen after NTC has its grading day. The nursing students are the first reviews, transcript reviews that the college does to ensure that you have met all of the requirements. Once that's done after graduation day, the information is submitted from the college to the website so that it can be you can be released to be able to move forward. So anyways, you create an account and you register with Wisconsin. The school, like I said, at some point after graduation does submit the statement that says that you graduated. And then once that information is all completed, the Department of Safety and Professional Services does review it all, and then they approve eligibility for you to take the NCLEX examination. The other thing that you do need to do is register for the actual NCLEX exam. So to register for the NCLEX exam, you go online and that is the actual website right there. The state office does encourage students who want to take the NCLEX exam to submit their application 6 to 8 weeks prior to graduation. The state will keep your application form on file until the school submits the completed statement of graduation form, which verifies graduation from the accredited program at NTC. They also notify Pearson VUE, which is your testing center. That's where you're going to end up going for to take the NCLEX exam, that the student is eligible to test. And once that's done, you'll then finally be able to select a test date. So after NTC's grading day, the records office reviews course completion and enters the graduation date into the system for the ADN students. And when the diploma is printed and mailed to the student, so once you receive your diploma in the mail, the statement of graduation form is also completed and submitted to the state. So that's why it's really good to have all of this completed prior, because then once you actually get your diploma, you should get your ATT or your authorization to test shortly thereafter. So after the Board of Nursing declares that you're eligible, it's at that point that you'll get your ATT or the authorization to test. You have to have your ATT to schedule an appointment, and you have to make sure that your ID matches exactly. The authorization to test or ATT email does contain your authorization number, and know that that ATT is only valid for a short period of time, typically approximately 90 days, and you must schedule and take your NCLEX exam within those 90 days. To actual schedule, then you'll go on to Pearson VUE. You'll schedule within that 90-day period and then take your NCLEX examination within that time period. So let me do a really quick recap. So Wendy Ludwig will send you an email, whether that's in March or mid-October. At that point, you can go on and create your online licensure application system. Once you graduate and once grading day comes, once NTC has reviewed your record and you have, yes, confirmed that you have taken all of the required courses and successfully passed them, they then send the appropriate forms to verify that, yes, you did indeed graduate. At that point, you will then be notified, and you will get your authorization to test. And at that point, you'll be able to go on and schedule your examination through Pearson VUE. So it is a little cumbersome, but when you get your letter, and I know that it might seem a little confusing now, but once you get your letter, at least if you're a North Central Technical College student, you will get your letter from Wendy Ludwig, and it is pretty clear in there as to what it is that you are needed and required to do. But it is okay to register ahead of time. Nothing will get sent until the college does confirm that you have graduated. So like I already said, the ATT, the authorization to test, does come in approximately 2 to 3 weeks after graduation. At that time, it's when you can schedule your exam. There are several sites in Wisconsin. The closest for individuals living in central Wisconsin is Eau Claire, Madison, Milwaukee, and they do have a location in Rochester, Minnesota. So those will be, right as of right now at least, those are the Pearson VUE testing sites. Know that the exam is scheduled for 6 hours, and at this time does have a cost of $200. That may change, but it'll be approximately that. There is no refund policy, so if you do register and back out, or for some reason don't end up taking the exam, they don't refund the money. And know that there will be 15 pre-test questions that aren't scored. These are kind of like questions that they're considering to use in the future, and they want to see how people do on them. But there will be instructions, the pre-test questions, like I said, and a break. All of that is included within your 6-hour time frame. So you will for sure have 75 questions and may have as many as 265. And like I said, if you're done at 75 questions, you've either passed with 95% stability, meaning you did really well, or you failed with 95% stability, meaning that you really bombed the exam. I have not heard of the exam shutting off at 75 and students failing, but it's always obviously possible. So the exam details, obviously, identification and check-in. Just know that your first and last name must match your ATT, your authorization to test exactly. When you actually go for the exam, the only acceptable form of identification really is either a passport or a driver's license. They also do accept a state identification card or military identification as well. But please make sure that you have your documents in order and put together so that that morning you're not frantically looking for your license, driver's license or passport. And make sure that when you register for taking the exam, that your name matches exactly. So that morning, the check-in process, I would plan to arrive at least to the test center at least 30 minutes before your scheduled test time. Like I said, you will be required to present a valid, acceptable ID. Typically, that you're also asked to provide a digital signature, potentially a palm vein scan, and also have your picture taken. Anything that's bulky, like hats, scarf, coats, they don't allow in the testing room or while you're being photographed. You do typically have to remove any watches or jewelry or any accessories. You won't be able to take your electronic devices in, so usually they provide a sealable bag for you. I wouldn't, your friends, family obviously they're not even allowed to wait in the test center. So if they're coming with you, maybe they need to go shopping for a little bit and then you call them when you're done. Just like when you test now, your personal belongings are left outside of the room, so it's just you. You must remain in your seat during the examination. These are just some of the things that they had posted. As for orientation of the computer, you will receive an orientation of the computer and test instructions. You are given breaks, so you have the opportunity for a break after 2 hours and again after 3.5 hours. But remember that is part of the total 6 hours, and the computer will automatically tell you when these scheduled breaks begin. And they do advise that you raise your hand at other times if it's necessary. So when we think about scoring, we either know it's pass or fail. There's no partial credit for any question. The results are not released at the test center. Examination results are only available from the Board of Nursing, and they can get sent up to 6 weeks after taking the exam. However, you can find unofficial results through the Pearson VUE website. If you by chance, which I hope that none of you will fail, but if you would happen to fail, the State Board of Nursing does send you a candidate performance report, and within that report it identifies the performance as to why you failed and provides the number of items administered to the candidate and to you, and also the summary of the strengths and weaknesses based on the test plan that you took. So I'm hopeful that none of you will receive that in the mail, but if so, look at that and use that to help you study for your next NCLEX examination. I know that I recently, well not recently anymore, but when I took my nurse practitioner board examination, it was pretty brutal. That whole check-in process, they wanded me and everything. I had to take everything off, even my fancy watch that had diamonds in it had to come out. I took nothing in there with me but the pencil and pieces of paper that they gave me. However, I've been told with your NCLEX boards now that you're sent in with a whiteboard and a magic marker, and you're only able to fill that up when you have it filled up. Then you have to ask for somebody to come and erase it for you. But anyways, for my NP boards, I took paper and pencil, and that was all I had with me. And at one point, I actually took my shoe off because I was fidgeting, and a lady actually walked in and asked me to put my shoes back on. So they're very particular, which they should be because it's a national exam to ensure that everybody is meeting the same competencies. But they are very strict, and I do suggest that you take a look through the process and take a look on their website. Okay, as for the technical aspects of the exam, there's questions, so there's multiple choice questions, there's alternative style types of examination questions. This can include visual or illustrations, the multiple response, so multiples, right? Fill in the blank, charts or exhibit, and prioritization, meaning like ordered responses can be in. There will never be true and false on the exam. All of the questions must be answered, and you're not able to backtrack or go back to prior questions. All the information that you'll need should be available on the screen, and there's where the supplies are. So this is kind of what you're given. The erasable noteboard and marker, a drop-down calculator, and earplugs are also available. So you can't take in your own calculator. You actually have to use the one that they provide for you. All right, so the bigger thing is here, what are we going to do to prepare for the prepare for your exam? First, I strongly encourage every single one of you to be in a review course. This is a great, I know that they're expensive, you know, $300 to $400 between whatever one you choose, but I assure you that it is worth the money. If you happen to fail, if you happen to not take a review course because of the money, and you fail, you're going to be out a lot more money than just the $300. You're not going to be able to work as a graduate nurse. I don't know what you're going to tell your place of employment if you already have a job. You're going to have a lot of anxiety going into the next exam. The review courses give a nice review of everything you learned from the first semester until your last semester. When I took my nurse practitioner exam, I did take a Fitzgerald review course, and I tell you what, there was many things on there that I was like, oh yeah, that's right, oh yeah, that's right, and then there was a few things that I'm like, ooh, I don't know that as well as I really thought I had known that. So I think it's great. It gives you a much better idea of what you need to study or what you need to go over, rather than just merely going through review books and review questions. I do think that the review books and the questions do have their value. However, I strongly encourage each of you to do a review course. Another great study tip has been just study groups. Making sure that right now you're planning for those extra costs, adjusting your schedule, plan for the travel, obviously staying healthy, and then, you know, study. This was one thing that I actually did when I was planning or studying for my family nurse practitioner exam. This is not my calendar, but I did create a calendar very similar to this, with the content, maybe not like a 50-item question test as on May 11th, but I did write down the content that I wanted to make sure I covered that day, and it was a great way to keep me on top of where I needed to be, content I needed to cover. So I encourage you all to try to make a study calendar and really stick to it. Give yourself time off, but make sure that you're studying. I mean, you should, after you graduate, one thing is take a review course, 2 is to study, and 3 is really to take that State Board of Nursing license as soon as possible. Those people who wait and wait, the information starts to fall off our brain, right? If we're not using it, we have more other things to take over. So I highly encourage you, as soon as you get your ATTs, to really get on there and schedule that exam. I know that you will have anxiety about even scheduling the exam. When I scheduled my NP exam, it took me 2 days just to be able to actually click the date because I was anxious about taking the exam. But schedule it, stick to it, get your study habits down, make out your calendar. You can do it. If you made it through this program or whatever program you're in, you can do it. Get past the anxiety, set the date as soon as possible, and take it and let the anxiety be over with. All right, so the day before the exam, Make sure that you have all of your stuff ready. Do you have your authorization to test admission papers? Do you have your personal ID? Sometimes it may be good to take a test run the evening before. Make sure you know where the test center is. Find the parking lot. You know, maybe even go in if you're that anxious. Go to bed early. Don't cram. Don't party. You know, make sure that this is probably the biggest exam at this point, unless you're going to continue on, that you're ever going to take in your life, and the results of it do 100% matter in your future. So I want to make sure that you're taking it as seriously as possible. The big day, you know what? Eat breakfast, dress comfortable. I would dress in some layers in case it's warm, in case it's cold, and make sure that you arrive at least 30 minutes early. Okay? As for test anxiety, don't allow negativity. You have to keep the glass half full. You can do this. I know that when you're studying and even thinking about that day, it's going to be like, I can't do this, I can't do this. You can do this. So stay positive. Plan, study, take breaks, don't cram. Think positively, and by far be confident. You can do it. Just some critical words. I'm not going to read through them. You can read them. So that pretty much ends our NCLEX, what's going to happen at least with NCLEX. One thing I wanted to touch really quickly on is the nurse compact in regards to the RN role. Please know that the Wisconsin is in the nurse compact. I do have a video in Blackboard on the nurse compact, so I do want you to take a look at it. You can also take a look at the Wisconsin State Board of Nursing website. But the individual state boards of nursing are, what this is really trying to say is that the individual state boards of nursing are working together, and the compact kind of functions much like a driver's license. So one license issued in the state of residence, but you're able to practice in other states. So if I want to move to North Dakota or Colorado or Texas, I can use my my Wisconsin nursing license. The big thing to remember is that all of the State Board of Nursing licenses, or the rules and regulations, although they're similar, they may be a hair different. So it's important that if you're working as a nurse in a different nurse compact state, it would behoove you to take a look at their rules and regulations to ensure that you are working underneath the right laws, okay? And I would also just check with the agency for which you're working with about any of the other nurse compact issues that there may be. So take a look. You can even watch the video on Blackboard. All right, so let's take a few minutes now. We have to get you from student to nurse, and obviously we just covered the NCLEX examination. But we know that there are many fields of nursing that you will have an option to be able to go into. And I think that is one of nursing's greatest advantages, is that you can be anybody or go anywhere you want to within this career. You could be a care provider at the bedside. You could go into research. You could be a case manager. You could work in administration, be an educator, a clinical nurse specialist, a nurse practitioner, or even a CRNA. So if you're unsure about any of those roles, please take a look at them. They all do require a little bit different education. Once you receive your associate's degree, I strongly encourage you all to get your BSN. But if you want to continue on to get your master's degrees or your doctorate degree, you will more than likely need to pick a focus, which will kind of choose your specialty and where you want to practice. So if you are unsure of any of those roles, please take a look at them. So what's happening in the market? We know that with the graying population, the projected nursing shortage is going to hit fairly soon, if it's not already. But we know that there's been fluctuations since the millennium. And what I often hear nursing students say to me is, oh my gosh, Vicki, there's no nursing jobs out there. I can't even find any positions that are posted. And my response to them is just relax. Relax, you aren't even graduated yet. I assure you that you will find a nursing position. It might take a little time, but you will find your nursing position, and it will be there for you. Just take your time, just keep watching. There will be openings, there always are, so just relax, okay? So when we think about the transition then that you're going to be experiencing very shortly, we have this transition from student to nurse. And we know that a transition really is a passage or a change from one situation, condition, or state to another that occurs over time. So entering the profession can be very scary, like a very scary realization. You're now faced with transitioning from student to an employee. When I first became a nurse many years ago, I was petrified to go to work for like 6 months. I swear, I would get sick to my stomach. I'd be like, oh my gosh. When I came in, if I was walking through the hallways and I had to look up and there was lights on the cardiac telemetry unit, I would think, oh my gosh, at 3 in the morning, somebody's got to be dying. I think that that is a definitely normal response, and that you will find that you will be experiencing that, and we're going to talk about some of those phases here in just a minute. But we all go through them. If you think back to any change that you've had in your career, whether that's nursing school, or whether that was your first job, your second job, or your third job, or even think about the first day of nursing school, or the first time you had to go in by a patient in a clinical setting, right? Your anxiety was through the roof. You probably didn't want to talk. You didn't know what to do. These are all part of normal transitions that you're going to be experiencing. One lady that I absolutely love is Patricia Benner, and she has 5 stages of nurse proficiency. The first really is the novice nurse, and this is really the beginner with no experience. So typically in years 0, when you first graduate, to about a year. So you're taught those general rules to help, perform tasks. You're just coming from school. You know, it's the beginning stage. It's that first year of learning how to transition from being student and what you've learned to now putting it into practice. The second stage is that advanced beginner. So you're starting to demonstrate acceptable performance. So that's usually between years 1 and 2. So you've gained more experience with actual patients in clinical settings, and you recognize and you can form meanings and relationships between what you're seeing and what you're doing. The next stage is competence. So this usually occurs when you're going to enter in year about 2 to 3 on the job, and it's in the same area, and you're providing similar day-to-day care for similar patients. You kind of finally become a little bit more aware of your long-term goals, is really in that competence stage. Proficiency. All right, once you enter and become more proficient, what stage that means is that you're really starting to perceive and understand situations as whole parts, meaning it's kind of that holistic understanding which drives improving yourself and improving the patients, really understanding that A and B go together. It's just the holistic understanding of the patient, of the environment, of the situation, of the treatment plan, and you really feel comfortable on the unit. And then the last phase is expert. So you're really no longer relying on principles, rules, or guidelines to connect situations and determine what actions. You have a lot of background, a lot of experience. Now, I kind of struggle with this because I don't think that we ever truly become experts. Even after being a nurse for 17 plus years, I would put myself in the proficient. I don't know. I just have a hard time thinking that anybody can be expert. I think that each and every day we learn, we trial, we error, we try new things, we do things differently to make ourselves better and better and better, rather than just proclaiming that I'm an expert in cardiology. There's just too much new stuff for me to think that even I am an expert. Oops. All right. So when you enter into your nursing career, I think that one of the biggest pieces that you're going to have to do is find these transitional relationships. So when we think of a mentor, it's an experienced nurse who assists and inspires. So they help recognize your weaknesses and your strengths. They help you set realistic goals. They help you attain these goals. Maybe they help you build self-confidence or gain professional satisfaction, but they really serve as an advocate for you. Now, a preceptor, so what I want you all to make sure that you find is a mentor. Okay, this is somebody that you look up to, that will help you no matter what, through thick and thin. They're going to be there for you. They're going to guide you. They're going to help you build your confidence. A preceptor, on the other hand, is an experienced nurse who helps mainly just orient a new nurse. So they assist usually a short-term relationship between 6 and 12 weeks, however long it takes before the new nurse, is going to be allowed to be able to work on their own. Sometimes preceptorships turn into mentors, but if your preceptor is not somebody who assists and inspires and guides you and helps you grow your confidence, just make sure that you have found somebody on the unit who can be your mentor and really is your advocate to being the best nurse that you can be. Role model is whether the role model is good or bad, it's merely just observing experienced nurses working, functioning, trying to learn, how to mimic from their behavior, and hopefully that you find good role models to be observing and growing from. Because we've all seen, I'm sure, improper practice, which can put a negative outcome for the patient potentially if things are not done to standard or to evidence-based practice. The one thing that I want you to look for is a residency program. And I know that in most acute care settings there are residency programs. I know that at St. Joe's and also at Aspirus they do have a residency program in which didactic, so theory and activities are kind of presented throughout the nurse's first year of employment. And it's really aimed at increasing knowledge regarding the care that you're providing. Maybe if you're going to be working on cardiac, they're going to spend 3 hours talking specifically about pacemakers 1 month. Or they're going to talk about chest tubes, or they're going to talk about, it's giving you more knowledge regarding the care that you're providing so that you're satisfied, knowledgeable, and that you really feel like you are a member of the organization and are doing the best that you know how to with the evidence that's out there. So when we think about what can we do now, I think that the most important part is functioning more independently. You're a 4th semester nursing student, which means that within a short amount of time you are going to be taking your own nursing team. So it's right now you really need to be taking charge of your learning. You need to be having realistic patient care assignments. You need to be delegating. You need to prioritize. You need to be working on time management, understanding your patient's cares or their disease processes. If I am a big advocate for learning in the moment. There are many things, maybe not many, but there are things that I still go to the hospital and I'm like, oh, what's that? A student has this patient. Oh, what is that again? And I quickly look it up. If you do not learn in the moment, if you care for a patient and you weren't sure about their diagnosis, and 8 hours later you finally looked it up, you were not providing effective care, nor were you an advocate for that patient. When you don't understand something, you quickly look it up and you move on. If you're one of those nurses who's going to wait until an hour to 2 to 5 hours later, you may have crucially missed something and potentially put your patient at high risk for adverse effects or consequences. So anyways, active learning, clinical skills, I'm not really big into that. I feel like skills will come when skills come. And I know that many students kind of fret about never having put an IV in or a Foley in or worked a tube feeding. But I assure you that if you've got the theory behind why you're doing it, that when it actually comes to you in the nursing practice of putting an IV in, it'll be nothing. It'll be easy. Will you be nervous? Sure, take another nurse with you. But if you understand the theory and the why behind what you're doing, that's what is most important to me. Your skills will come. All right, so transitioning or preparing for transition, obviously think positive. It's very easy to be sucked down the negative vortex of people. Um, so trying to avoid them when you first take your nursing job. Stay away from the cackles of complaining. It's okay, just walk away. It's not going to help you. It's just going to suck you down into a vortex where you don't want to be. Making sure that you keep things in perspective. That whole first year of you being a nurse, you're going to cry, you're going to laugh, you're going to be frustrated. I assure you of all that. You're going to be uncertain. Things are very shaky that first year. You're learning how to be a new nurse. You're learning how to be an effective team player. You're learning how to cohesively work with those around you. It's a definitely a trying first year, but many nurses have done it, and you will not be the only ones who struggle. I assure you that. Other things to consider is obviously be flexible and getting organized. I think that organization is key to nursing success. If you're an organized person, if you have your brain sheet figured out, if you know what you need to do, if you know what you need to do, when you need to have it done by, and you are constantly tweaking that, I mean, sure, will things go as you plan them every single day? Nope, I assure you they won't. Things change. But being organized and staying on top of things is going to be crucial to your success. For sure, staying healthy. Like I said, finding that mentor is essential. You need to be able to find somebody on the unit that you can cry to, that you can be happy to, that you can go ask really dumb questions to and not feel like it's a dumb question, who can encourage you, who can pump you up, who can say, you got this, come on, you got this, you're doing great, or hey, you know what, I would have maybe done this a little bit differently next time. But finding that mentor is very important to your success and your mental health as well. And then for sure knowing what is expected of you. So when you're interviewing for jobs, things like that, make sure that you're understanding what the unit is about and what the nursing care is required. If you're a new nurse and you work in a nursing home and you thought you were going to take care of 5 and you've got 25, there's a much different perspective that you're going to need to take on before working your first shift on your own. So when we think about transitional experiences, let's take a few minutes. I always love this little snowman because the what nursing students think, right? This nice snowman. Even when we present you in clinical, maybe it's not this picture perfect snowman, but we don't really show you the true, you don't get to see everything that goes on just because the nurse is still handling things even when you're with them. So oftentimes the expectation and the reality, nursing is a great field, so it's not as mucky as that bad snowman looks on the right, but a lot of times our expectations and what reality is, they can be different, and especially know that that is true in that first year of being a nurse. So take a look at that slide. But there are some phases that I would like to go through in regards to reality shock. So, reality shock is defined as the reaction experienced when one moves into the workforce after several years of educational preparation. So this begins as the graduate nurse really adapts to the reality of the nursing practice. So what really happens is during that reality shock, the new nurse will become aware of the inconsistencies from what is taught in school and how individual nurses choose to practice at the bedside. Like I said earlier, you will choose what kind of nurse you will become. Remember that just because another nurse is doing it, it doesn't make it right. I want you to go back to the backbones of what you were taught. Stay current with the hospital policies and procedures and with educational practice and evidence-based practice. I can't stress that enough, that you will choose the nurse you want to become. If you want to be the sloppy nurse who doesn't care, please don't take care of me or my family members. Be the nurse that you would want taking care of you is all I can stress, because you will be the nurse you want to become. And if you start noticing things that you don't like, change. Be the nurse you should be. Be the nurse we've taught you to be. Anyways, we do know that reality shock does lead to a great deal of stress. And so what I do, and like I said, you will struggle, you'll be frustrated, you'll be happy. But the reality shock really does have 4 distinct phases with it. The first one is the honeymoon phase. And this is really the phase that occurs once you first graduate. And usually during the entire time that you're on you have a preceptor that's with you for 6 to 12 weeks or however long the orientation phase is. So you're excited with your new job, everything is great, you're laughing, you're like learning, you're relieved because you don't have to study, do any more homework, you're not being a student anymore. But truthfully, in the honeymoon stage, you're really not seeing the entire picture. I do want you to enjoy this phase, but it's important to continue to grow and learn. Seek out different educational moments while you're still in orientation, because this is definitely going to make you a stronger and more competent and confident nurse for your upcoming phases. If you're going to work on a cardiac floor and chest tubes and epidural scare you, it is during that orientation phase then that you and your preceptor should be taking everything that scares you so that when you're on your own, you feel more confident and competent to be able to take care of those types of patients. The second phase that we move into is the shock. So shock is really your orientation is over and now you take a team of patients and you function as one of the teams. So this is typically within 8 to 12 weeks onto the new job, just really depending on the unit, and maybe longer if you're working in intensive care. But you'll face many new skills and experiences that may make you feel incompetent and uncomfortable. Okay. Oftentimes you will become more critical of your own skills and abilities because you're feeling a little doubtful. You may second guess your thoughts or decisions, and you will typically feel like a failure, maybe scared, maybe defensive at times if somebody's asking you why you did something, maybe a little rejection or a lack of accomplishment because you have to frequently ask for advice, but that is normal. Ask questions. Ask the experienced nurses who are around you. That's why they're there. They're there to help you, okay? And then also you can read through the bullets, but decrease energy, mistrust, increase concerns, failures, hypercritical, and moral outrage, okay? So this usually happens, like I said, once you're on your own. And this is what you're really going to feel like, is that you're just stressed all the time. You may be scared to go into work. You may feel like you can't do it, and know that you can. And the reason why I also put this slide up here is I want you to be careful about how you present yourself when you're stressed. You may act out differently, maybe you become really quiet, maybe you become snippy, but people will judge you by how you handle yourself. And I know that like when I feel a little stressed out, I become a little bit more withdrawn and I really get into work and I really like focus really hard so that all of the things that I need to get done or understand are done. But that may be hard for others to understand, especially when I'm most of the time joking and laughing and talking. Maybe people think I'm mad or upset when that really isn't the truth. So just know that, just take a minute and really look back on how you act when you're stressed, because you may need to modify that, especially in front of patients or other peers of yours. During the second phase, there are some shock reactions, and I'm not going to, you can take a look at these yourself. We also have burnout that occurs during shock, and nurses are more prone to burnout and compassion fatigue, really, for sure in phase 2, but pretty much throughout their nursing career, nurses can experience burnout and compassion fatigue. Nurses are typically more prone to burnout and compassion fatigue, because we have this, like, I don't know, like this feeling that we have to be perfect and that we can never say no to anything. Um, so all I say to new students and new nurses is that it's okay for the first year to not be saying yes to everything. It's okay to say, you know what, I'm new, I want to get this handled first. Once I feel more comfortable, I'll be on that nursing committee, or I'll help out with scheduling, or I'll help out with, whatever committee work that needs to get done. But new nurses often become burned out because of multiple responsibilities they undertake. So it is important, like I said, to be involved, but only really when you're ready. Now, compassion fatigue, on the other hand, is really more related to repeated exposures to to similar patient experiences that makes one at high risk for compassion fatigue. Um, or our unit, CTU, cared for a patient, and he was a younger gentleman, and he had severe congestive heart failure. He was probably in his 40s and 50s, and I'll be honest with you, the guy was very rude. He swore, and we would treat him. He'd come in, he'd get his Lasix, he'd get tuned up, he'd go home, he'd come back within the next week. He was very non-compliant. He was not very friendly. Um, like I said, he swore. He was just mean. Although I kind of formed a little bond with him, and we always were fine. But there were many nurses who had compassion fatigue for this patient, and it did alter how they cared for him. And so you have to be cognizant of compassion fatigue, and if it does start to occur, you do need to remove yourself somehow, because all patients, just like we had talked about in our ethics lecture, are required to receive the same amount of care and receive the same type of treatment that the next patient does. So if you start noticing burnout or compassion fatigue, one, be alert to it, figure out how you can counteract your feelings, make a change in the nursing assignment. Maybe you need to just take a vacation. I know that sometimes nurses can work ungodly hours and for many days in a row because they pick up, but is it always good? I don't know. So just be on the alert for it. Our third phase is the recovery phase, and this is where we really have our sense of humor returns. So we really started having enjoyment with being a nurse. We do have decrease in that tension, anxiety, and the increase in ability to be objective. So they really, as a new nurse, you'll have a sense of belonging. Your humor, like I said, you'll laugh about little silly mistakes, nothing that's going to hurt the patient. Or learning is still occurring, but it's getting better. And then our last stage is resolution. So the resolution is that the new nurse has adjusted to the new environment. And like I said, this usually does take about up to the whole first year. So then you now really begin to enjoy. You don't dread coming to work. You feel more confident. You start getting involved. You feel as though you're starting to make a difference. Maybe you start becoming a change agent and feeling like you can evoke some change in some of the practices that you see. So what do you need to do in the meantime to survive the transition? First off, I want you to sit there and analyze yourself now. What happens when you feel stressed? What are you going to do about it? So the other thing is think before answering. Don't just always say yes. Don't just give an answer. Maybe you need to say, I need to get back with you about it. I need to think about it. Take a break, treat yourself, get rid of minor things that drain your energy. Wear comfortable attire. Seems silly, but it's the truth. Avoid negative people and say no. I mean, if you get in trouble, don't say Vicky said to say no, though. All right, and then I think this is the key. Attitude is everything. You have to have the glass half full. You can do it attitude, because there's going to be a lot of things that you're not going to feel like you can't do, but I assure you that you can do it. You can take a look through that slide. One thing I do want you to take a look at, or at least have in your mind, is where do you see yourself in 5 to 10 years? I think that it's important in your nursing future and your nursing goals right now is to know where you'd like to potentially be in 5 to 10 years. What is your academic goal? And that doesn't mean that I say that you have to go on and get your bachelor's, master's, or doctorate's degree. But what about advanced certifications? Do you want to go on and get your ACLS? Do you want to become PALS certified? Do you want to be a wound certification nurse? There are many certifications that a nurse can get to make themselves a stronger, more knowledgeable nurse. So take a minute and jot down where you think you see yourself in 5 to 10 years. All right, then lastly, I'm not going to take a look at these, but please make sure you take a look at the evaluations information. I believe your book does a pretty good job with it. So that is it for the RN role. I also want you to make sure that you are getting your professional portfolio completed in a timely fashion. Your mock interviews hopefully are going well, and your cover letter and resumes are also going well. If you have any questions about those, please let me know.